This capsule is used to treat specific severe fungal infections. It belongs to a group of medications called azole antifungals. It works by preventing the fungi from growing. The daily dosage and optimal timing of this medication should be determined by a doctor. Before you start taking Isavuconazonium sulfate capsule, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually every 8 hours for the first 6 doses, 48 hours. After the first 6 doses, take this medication once daily, 12 to 24 hours apart. Do not chew, crush, dissolve, or open the capsule before taking it, as directed by the manufacturer. This medication works best when taken at evenly spaced intervals to maintain a constant level of medicine in your body. It's important to continue taking this medication until the full prescribed amount is finished, even if your symptoms improve. Stopping the medication too early may cause the infection to return. If your condition does not improve or worsens, be sure to inform your doctor. Some common side effects of Isavuconazonium sulfate capsules may include dizziness, nausea, vomiting, diarrhea, headache, constipation, cough, and trouble sleeping. However, many people using this medication do not have serious side effects. It's important to tell your doctor if you experience muscle cramps/spasms, weakness, irregular heartbeat, swelling hands/ankles/feet, back pain, or mental/mood changes. Also, seek medical help immediately if you experience fast/irregular/pounding heartbeat, chest pain, fainting, signs of kidney problems, or seizures. Rarely, Isavuconazonium may cause serious liver disease or a severe allergic reaction, so it's important to get medical help right away if you notice any symptoms of liver damage, a severe rash, or signs of a serious allergic reaction. If you notice any other effects, make sure to contact your doctor. Before taking Isavuconazonium, it's important to talk to your doctor or pharmacist about any allergies you may have, as this medication may contain ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have liver disease or a family history of certain heart problems. This medication may cause dizziness, especially when combined with alcohol or marijuana. It's important to avoid driving or operating machinery until you know how this medication affects you. Limiting alcoholic beverages and discussing marijuana use with your doctor is also important. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, it's important to talk to your doctor about the risks and benefits of using Isavuconazonium. Reliable forms of birth control should be used while taking this medication and for 28 days after the last dose. If you become pregnant, it's important to speak to your doctor right away. It's unknown if this medication passes into breast milk, so it's important to consult your doctor before breastfeeding while using this drug. When taking Isavuconazonium sulfate capsule, it is important to be aware of any potential interactions with other medications. This medication can slow down the removal of other medications from your body, which may affect how they work. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Additionally, other medications can affect the removal of Isavuconazonium from your body, which may affect how Isavuconazonium works. It's important to discuss all medications you are taking with your healthcare provider to ensure the safe and effective use of Isavuconazonium sulfate capsule. If someone has taken too much Isavuconazonium sulfate capsule and is experiencing severe symptoms like losing consciousness or having difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center for assistance. Remember, it's important not to share this medication with anyone else. This medication has been prescribed specifically for your current condition, so it's crucial not to save it for another infection unless your doctor advises you to do so. Make sure to attend all scheduled medical and lab appointments, as your doctor may want to conduct tests, such as liver function tests, while you are taking this medication. If you have any questions or concerns, don't hesitate to consult your doctor for more information. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. When storing Isavuconazonium sulfate capsule, make sure to keep it in its original container at room temperature, away from light and moisture. It's important to not store it in the bathroom, and always keep medications out of reach of children and pets. Remember not to flush these capsules down the toilet or pour them into a drain unless specifically told to do so. When the medication is expired or no longer needed, be sure to properly dispose of it. You can consult with your pharmacist or local waste disposal company for guidance on how to do this safely and effectively. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.